I like to talk about tips and tricks and my nursing journey, and today I just thought I would share some tips and tricks that I've learned along the way and some funny stories. One of the things that I want to talk about is catheters. You all know that putting catheters in can be challenging, right? So many moons ago, I was a treatment nurse and I was responsible for changing all the catheters monthly. I think the guidelines have changed a little bit about how often you change a catheter due to risk for infection. But it used to be that you changed the catheter every month and you would change the bag every 2 weeks. That's just the routine that we did. I think it's changed a little bit over the years. But I had this patient that was a bilateral above the knee amputee, and that particular patient would I would explain the procedure and tell her what I was going to be doing, and she would agree to the procedure. But when it came time for the procedure to be done, once I got the catheter out and it was time to put the new one back in, it became a fight for my life. I don't know if you've ever been kicked with stumps, but it is quite a scene to see a nurse standing on her head, putting a catheter in the bed with the patient while they are kicking you in the head with their stumps. It often took 2 CNAs and myself to change this catheter out every month. She was never hurt, injured, or anything in the process, but she would yell the whole time. And I can't imagine what anybody thought if they were outside of that room once a month when I had to change that catheter. The fact is, I had to have help to change that catheter every month without fail, because no matter how many times we did that catheter, she just did not want to have that procedure done. Unfortunately, that's one of those things that you cannot just leave a catheter hanging out in there forever. Well, you couldn't back then. So there was no magic trick there. Even with the help of the CNAs holding her legs, she would still manage to kick me in the head with those stumps. Never hurt me, but I know that it was funny because the CNAs often had to hide their laughter during the procedure. So one of the things with catheters is, as you know, when ladies get older, sometimes they can't lay on their back and open. It's just not possible. And sometimes with bigger girls, like, you're not going to be able to see what you need to see. So my tip and trick for catheter insertion is to turn them on their side and go from the back. And you can maintain a sterile procedure when you're doing this. It is possible, and it is really easy and really fast. And I think in some ways, ladies feel less. It doesn't feel as invasive to them if you're quick and efficient about it. The big thing about catheters is that it's a sterile procedure. You don't want to contaminate, and you want to be able to see where you're going, because I'm going to tell you something too about us as we get older as ladies. Sometimes the meatus is not where it should be that you learned in your textbook. Okay, sometimes there's some atrophy that goes on in older ladies, and that meatus is down in the vagina. It's just the way it is. Trigger alert, I'm going to say words that probably might be offensive to some people. But, I've seen the meatus down in the bottom. I've seen it inside. I've seen it in a place that I did not know it was going to be. So just be aware that as we get older as ladies, sometimes things atrophy and the anatomy changes a little bit. And another thing is, I love doing suprapubic catheters. People are very intimidated by suprapubic catheters if they've never done them, but I'm just going to tell you that is the easiest catheter to put in. However, you need to be sure that you have all of your things ready to go and do it as quickly as possible, because sometimes that can be painful for the patient. So I think suprapubic catheters are my favorite to put in. I'm never intimidated by those at all. And I'm just going to tell you that I don't love condom catheters, but they have advanced a lot in the years. Back whenever we used them, when I started, The condom catheters had a little piece of tape that went around the end, and you stuck it to that. And the thing about condom catheters is that they don't stay generally in most cases, and they're kind of hard to get on the patient. So, but if you do, you just want to make sure that you have one of the sticky ones. The ones that are sticky inside are the best. And it shouldn't be a patient that's mobile. If you're going to use a condom catheter, it really should be a patient that is truly bedbound and isn't trying to get out of bed, because they're going to pull it off and they're going to rip hair. It's just a fact. And one of the things that I learned taking care of geriatrics and putting in IVs, you have people that some people are just not easy to get an IV into, especially when they're dehydrated and they're older. When we would have to give a bag of fluids in a long-term care setting, we're not putting an 18 in. I guarantee you we're not putting an 18 in. We would hope for a 22. And one of the places that I found that I could get a line in for fluids, or, something that didn't have to go in fast, is right here. You have a vein right here that you can hit on most elderly folks if you're doing something short term that you just need to get a bag of fluids in. It's not going to stay. But it is good for a bag of fluids, and it is an easy place to get if you can't get anything else. Because sometimes when you're doing IVs for older folks, you'll get the line in and it'll blow. And honestly, in geriatrics, we don't do a lot of starting up IVs, but in a skilled nursing setting, you're going to start IVs sometimes, and you're going to be expected to know how to do that. So always stay good on your things. And I've got to tell you, whenever I do an IV or a blood draw or something like that, I am so proud of myself when I get that flash of blood. And I've been a nurse for 24 years, so I got to tell you, even now, I get nervous when I have to do a stick on somebody that's older, because I know it's not as easy to get in there. And when I get that flash of blood and it's effective, I'm so proud of myself. Now, I know these ICU people and hospital nurses are putting in IVs every time they turn around, and they're very skilled at it. And I have had to sometimes go and get somebody who is better than me. We had a rule in the facility that I worked at that it was not more than 3 sticks, but I'm telling you, I never did more than 2. If I couldn't get it in 2 tries, I wasn't going to keep going. Because most patients would allow you to try them a couple of times, but you're not going in that 3rd time. And I wouldn't. I would say if I didn't get it the 1st time, I would try it the 2nd. If that was not going to happen, I would get somebody else. I've had to get somebody else to do it for me. But I tell you, in hospice, you don't start a lot of IVs, but you do draw blood. And the good thing is that this is pretty reliable for drawing blood. And I'm still okay at getting those samples, and I'm still proud of myself when I do it, because like I said, you kind of lose your skills a little bit, and you're proud of yourself when you still do it right. What are some other tips and tricks that I can think of to share? Have you ever used Tegaderm on a wound? When you're going to take Tegaderm off, you use Tegaderm for IVs too. If you pull the edges, it'll come right off, and it doesn't hurt the skin. So if you pull the corners, it pulls the dressing right off, and it doesn't cause a skin tear. The other thing that I learned is when I was doing wound vacs and you had to cut the foam to go inside the wound. They've come a long way with wound, but I've still seen sometimes the foam wound dressings. If you open the package and put the clear plastic on and trace the wound, you can cut the foam to the size. I don't know, that worked for me, and my wound vacs would stay in place until they had to be changed again. The other thing is skin prep. Skin prep is your best friend when you're doing a wound vac, because those leaks in the wound vacs are the things that really get you. They're the things that make your shift hard when that wound vac is starting to beep, right? Beep, beep, beep. The beeping wound vac is not your friend. So you want to make sure that you bridge wounds so one of the things that I really learned to do was to use a piece of Telfa on the good skin and bridge, as wounds heal, sometimes they'll heal into those islands where there's a little flap of good tissue there, and you want to kind of preserve that good tissue, right? So if you put a little Telfa in between and you bridge into the wound bed with the Telfa, it'll be a good seal. And the wound vac, you won't have to do 2 separate places. That may be something that people already know, but wound vacs can be intimidating to change if you've never changed them before. How about Zosyn? Mixing Zosyn. That's always been a challenging thing, but I think most of us know that when you spike the bag, you're going to squeeze some of the solution in there and bring it back into the bag. But I have seen nurses who don't really know, and Zosyn is one of those things that doesn't dissolve easily. And there's a lot more new antibiotics coming out, since you can tell how long it's been since I've been on the floor. What are some other tips and tricks that you could share? I would love to hear them and put them into practice if I could. Another thing is, I had patients who couldn't necessarily lift their leg and hold it. There's times whenever you sometimes are alone when you're doing a dressing change and you don't have help to lift a leg. But I will tell you that if you put a pillow under the thigh, you can use a Hoyer sling. You can use a Hoyer sling to lift a leg if you have to. You can use a Hoyer lift to help you lift a leg if you're by yourself and you can't hold the leg, because as you know, when you're standing over a bed and you're doing a dressing change, sometimes it's really challenging, but pillows are your best friend. You can prop the leg up on pillows if the patient can tolerate it, and you can also, I have had to use a Hoyer lift on heavier legs to hold the leg whenever I didn't have assistance. So you would support the thigh with pillows and you can bring the heel up with the Hoyer, and it'll get you to the calf really easily. And turning people on their side, if they're able to tolerate it, is a good thing to do too. So those are my tips and tricks that I thought I would share. And again, I would love to hear your tips and tricks. And I thank you for watching, and I hope that you watch again. And if you like my content, then please consider liking, subscribing, and following. And thank you for watching. Bye bye.